Hi, my name is Anikan and I'm an ear, nose and throat consultant that specialises in managing problems related to the nose. I'll be talking about in this video revision septorhinoplasty surgery. Now, I perform a wide variety of operations related to the nose, but often patients will see me after having surgery before on the nose and will have ongoing problems with their nose, either from the aesthetic point of view, from the way it looks, or from a functional point of view. And I'll talk about how I assess patients and then how can manage them with revision septorhinoplasty if indicated, and how that process will then work thereafter. So often if there is after an operation of the nose, then that could be a septoplasty, so a change in the middle part of the nose to make it from deviated to straight, or a septorhinoplasty. There are multiple changes that happen within the nose and the nasal structure that only are usually appreciated at about 1 year after surgery. And that's because the tissue of the nose heals and the complex 3D structure of the nose then settles into the shape that it will be long term. Now, initially after surgery, the nose is very swollen, so these variations may not be appreciated. At about a year, you will see that. Now, if there is a problem with the aesthetics of the nose and the way the nose looks after such surgery, there are different types of operations that can be undertaken to manage that. So for example, I've seen patients where there is a dip in the nose here after surgery where it's dropped, and that can be managed by using tissue from inside the nose to then fill that area through incisions inside the nose. There's sometimes a fact where the nose has become wider, or the bridge of the nose has become wider, and that can require further revision surgery to sculpt the nasal bones or mold the nasal bones into the correct position. There can sometimes be problems with the function of the nose after septorhinoplasty surgery. So if someone has had a dorsal hump removed to become straighter, that can affect the structure of the middle part of the nose and lead to that caving in. So when someone breathes through the nose, they find it difficult to breathe through the nose, or make a nasal septal deviation worse. That type of problem often requires a larger reconstruction. So revision septorhinoplasty surgery starts with a thorough assessment to understand the problems the patient may be having, and understand what is possible and what's not possible from revision surgery. Because certainly I always stress to patients that I can't necessarily change the nose to how it was previously or make drastic improvements, because often the surgery can be difficult the second time round. However, to understanding the concerns and understanding what's feasible, often a shared decision can be made between the surgeon or the patient and myself to work out how to manage things moving forward. So revision septorhinoplasty surgery, the things to consider are that often cartilage may need to be brought in from other areas, such as cartilage from your ear or from your rib, and soft tissue such as tissue from under the skin behind the ear may also need to be brought in as part of the surgery to smooth over any defects. The surgery is often more complicated and can be longer because of those reasons, and certainly recovery after surgery is often longer with more swelling and also variations in terms of how the healing occurs, because often the surgery involves revising through scar tissue and through previous surgery. So with revision septorhinoplasty surgery, it's important the patient realizes that this can be a longer journey than for the first operation, and also there's a psychological element for the fact they've undergone surgery before which hasn't been necessarily what they'd aimed for, and the revision surgery can also be a very taxing time for them. So making sure that I'm able to support them through that time is vitally important. So in summary, we've talked about revision septorhinoplasty surgery for both aesthetic and functional reasons, and the differences from septorhinoplasty surgery the first time compared to revision septorhinoplasty surgery.